Hi, Adam, how are you?
I'm doing well, thank you.
So where are you now in the world? Where are you sitting now?
I am in San Francisco, despite my beautiful Alaska
Yeah,
backdrop. This is where my brain is in
right, right.
nature
Looks
as
good.
much as
Looks good.
possible.
Yeah,
But yeah, this is from a trip from years ago. But right now I'm in San Francisco. Yep, and I have been
cool.
here for this whole time period.
Nice. So look for us for Against for Change, and for me personally, it's like closing a circle because I think that you came to Against for Change in 2013.
Mhm.
You
Yeah.
gave a keynote claiming that you're going to be the first man to get FDA for a video game, FDA
Mhm.
approval. And I think that check on
Yeah.
that mission, and it's very fresh. That's the interesting thing. The
Yeah.
timing. It's like 2 weeks ago,
Yeah. 2 weeks ago. Yeah.
something like that. So that's
Exactly. Not even.
great.
Yeah.
That's
Yeah.
great, and that's what I wanted to talk about with you. And really, the first thing that I wanted to ask, but also by part of introduction, you're a professor at the University of California, San Francisco.
Mhm.
You're also heading the lab
Mhm.
where that project was actually NeuroRacer, the old one,
Mhm.
came from there.
Mhm.
You're
Exactly.
also the co-founder of Akili,
Mhm.
of a VC that invests in
Mhm.
those type of endeavors. Another startup,
Mhm.
Sensing,
Sensing.
which is
Uh-huh.
VR immersive. And then you are also a photographer that travels all around the world. So how do you prioritize? How do you divide all the passions?
Yeah, it's a good question. I often ask myself that one as well. You know, it, I think when someone first hears about what I do, or I try to explain it, it feels that I'm spread thin. Like I have so many things going on, and I must be like frantic and trying to keep everything organized in my mind. It doesn't feel that way to me. I feel very busy. I'm not saying that. That's a lot
Right.
of activities,
Must
but
be.
undoubtedly. But if you look at what Neuroscape does, which is my center at UCSF, and I'd say like my real full time job,
Hmm.
if you look at Achilles and Sync, Jazz, the talks I give, the books and articles I write, um, it's one thing. I'm
Right.
interested in how we can use technology to enhance our minds, the human mind, and sort of elevate us as a species. And everything I do is directed to that. I have one voice, one message, one mission. And so there's lots of ways that I've engaged in lots of platforms to achieve that through academics and research, invention, entrepreneurship, venture, but it's
Right.
all one thing. So it allows me to do a lot more than I think people that might have a lot of things, but they're all different. They all have different backgrounds and
Right.
different goals. I don't really have that. So, that's sort of how I do it. And, I just work all the time. To me, it doesn't feel like work. It feels like play. I think that makes a big difference. But yeah,
Right.
that's sort of
And
how
the
it
and the
goes.
majority is the lab. It sounds like
Yeah.
the anchor or the home is the lab.
It is because, the entities that I created to translate my inventions and my research into the real world have like executive teams and
Right.
CEO, like Eddie Martucci
Yeah.
at Achille, and my partners at Jazz Venture Partners, and our CEO at SynSync. And I'm essentially like the CEO, executive director of Neuroscape. So that, when this crisis hit and we have our financial challenges and our labs are shut down, I'm full time taking care of those people. And of course, I'm always available and working with all these other entities, like they're my babies as
Yeah.
well.
Yeah.
But that's where I would say my full time effort is.
Got it. So, we won't have time to talk about everything, obviously, even though everything is exciting. I want to start with the Kili and the FDA because it's so
Of
fresh.
course. Yeah.
And it was a long time mission of yours, and it's an amazing milestone and achievement for the whole sector, obviously. Are you when you ran for this FDA approval, were you aware of all the others that are still in the race or are trying to do this in video games?
Yeah, as you said, it's just been such a long pathway. For me, it's been 12 years from
Wow.
the idea of a video game, and not a video game, this particular video
Yes.
game, to building it with friends from LucasArts, to doing the first research studies, to our Nature paper, to starting Achilles, to patent filing, and then all the research, and then the FDA process, which itself has been 2 years. So
Right.
it's sometimes hard for me to like even remember all the different emotions and elements. When we were starting to go to FDA approval pathway as a class 2 medical device, which it's now cleared for, and it's a de novo pathway. So that tells you a lot to answer your question. The fact that it's a de novo pathway as opposed to a predicate pathway through the FDA means that it's not resting upon pre-existing clearance. So it is a new classification at the FDA.
Altogether, right.
Altogether. And so we are aware of other groups doing things similar in digital space, like, cognitive behavioral therapy and work like, great groups like PAIR are doing. But what we've done is so different because in some ways it's almost like a pharmaceutical, like a molecule in that it's very, its mechanism of action is very targeted to neuroplasticity in these systems, but it is delivered through an experience in a digital format. So it crosses multiple genres. So we didn't really know of other people doing exactly the same type of treatment that's really to the patient a video game.
Right.
So we sort of felt like we were out on a limb, and a lot of people and groups were watching and seeing how onerous the process was going to be, how expensive, how long, is it actually even going to happen? And now I get a lot of emails from people that maybe would be thought of as competitors. Personally, I don't really believe in competition. I believe in cooperation. There's so much to do, so much need. And so when I hear from everyone saying, wow, now there's a predicate pathway that can be followed for this. And I think it'll activate a lot of new treatments.
That's cool. It's interesting that there's no one close or that you know of that is going to be the next one. But it's interesting to hear that many people are approaching you. I know that you guys made a decision that was, to me, pretty provocative to not distribute before you get the FDA approval. So, I mean, there was testing, obviously, because it's part of the process, but you couldn't get the product, correct?
You could not. That was a big decision. I think it's a very unique decision. There are definitely other groups that have had FDA sites and medical device pathway, but as far as I know, almost all of them also had a consumer product out there, and there was revenue generation occurring. We did not do that. We have not sold anything yet, which is, been a challenge to an investments and venture pathway. But it's not unheard of in a medical device or drug pathway to do that. So we made that decision. We wanted to keep our sites really focused. We wanted to keep our messaging very clear in that this was our mission to basically help everyone from patients to doctors to regulatory agencies, now to insurers, to think about medicine differently, to think that it doesn't have to be a molecule. It can be a digital treatment. It can be a video game. And so in order to accomplish that goal, it's more than regulatory approval. It's like a paradigm shift in thinking. And we felt that would be aided by just sticking to one clear goal. So the only exception I'd say to that is around, I think it's maybe been a month, the FDA allowed for an emergency, in an emergency release for certain clinical mental health conditions, digital products that had data associated with them. So actually right before our clearance, which was coincidental, we went to market for free product only because of the COVID crisis. And that just filled a little bit of the gap before we got our clearance.
And the COVID didn't influence at all the longer path? It was just a coincidence that it's the same time?
It seems so. I mean, we'll never know for sure, but it's been a long time at the FDA. There was a lot of education that had to be done. We kept collecting more data and having more studies and different perspectives on it. But even before the COVID crisis, our expectations were that we would be hitting this milestone or not hitting it at all around now.
But you had some positive. I remember talking to you, I don't know, maybe a couple of years ago. You had a positive feedback from them. Like you knew that you're on a good trajectory.
It's always like it's always mixed, right? Like if it's so positive, then why isn't it there yet? Well, and then there's sometimes differences between different just individuals, not just the agency, right? A lot of it comes down to some people are like, this is the future. I love this. And other people are like, I don't know about that. That's a video game, you know?
Right.
So there's this human elements as well. And there's just so many factors. And then there's the policy decision of the FDA wanting to be innovative and be future facing. And then the real life of process and different, you know, different groups that are not at the policy level. So it's as complex as anything I've ever, you know, imagined.
Yeah, amazing. Now, I wanted to ask you about another decision, like one that is very, very core to the process that you went through. So, you know, when you spoke at Games for Change, and the original idea, just to go back in time, was around seniors. I mean, cognitive decline, dementia. This racing game that I think you dreamt of one night, and
Exactly.
And came to be. And then there was a decision when you went commercial with your partners to say we're actually going for a different audience and for a different condition, right?
Exactly.
ADHD kids.
Yep.
So
Yep.
how that came to be? Why is that pivot?
Yeah, it's a really great question, and one that I don't often get asked, but is really relevant. You know, I've been in neuroscience now for pretty much around 30 years, and even when I was a grad student, I always focused on aging. That's really my area of expertise, is the aging brain and cognition. Most of my papers and grants have been along those lines. And NeuroRacer, the paper in Nature in 2013, as you mentioned, was on older adults.
Yes.
And we're still continue to do a tremendous amount of research on aging process at Neuroscape, as well as now children and childhood challenges of cognition. But when Achille licensed the patent that is owned by UCSF, I'm the inventor, Achille has the license, that's our three-way relationship. When Achille started developing the video game on top of the core technology, so like the next level of NeuroRacer, which is what Endeavor really is, there was some business decisions in addition to all the technical design aspects, and they were related to each other. Who's this game being built for? Who's the audience? And it was felt at the time that because attention being the primary outcome is impacted by so many different conditions. And we have clinical trials and things as diverse as autism and post-traumatic stress disorder, traumatic brain injury, depression, multiple sclerosis, all of these conditions, we have data for benefits from this same game, because the game doesn't really focus on a condition, it focuses on the attentional system.
Right.
And so if that's the hypothesis, that this game could benefit essentially anyone that needs improvements in attention, then we had a different decision to make. It wasn't necessarily an exclusive decision that we would never focus on one population versus another. The question is, who's the first population that we put all of our design efforts and marketing efforts and FDA focus and clinical efforts to validating at that higher level that we need to get approval. And for there, it was felt that, and I agreed to it, it wasn't necessarily my idea, that children with ADHD, the need is so high because, as you know, the status quo has been that it's all stimulants, which have lots of side effects. And a lot of parents just don't even want to put their children on these medications. So it wasn't that the need wasn't there for older adults and early dementia and these other populations, but we felt from a business and an impact perspective, children with attention deficits that have been increasing, that are now only likely getting worse with the COVID crisis, was a really important and wise focus for us. And so we wrapped our heads around it and said, that's the population, children with ADHD, that we're going to start with.
So there was something buried or not buried in what you said that is, I think it's fascinating. So you basically say that during your tests and during your research, going back even to NeuroRacer, you saw the effects on other areas. So in theory, you mentioned depression, for example. In theory, you could take now the same creation and go for an FDA approval process for depression?
We are. I mean, that,
or a different demographic.
Undoubtedly, that's how it works, and always has worked, is that you need to have the clear clinical indication and the data to go along with it to get the regulatory approval. So as we now release data on depression and continue to move through the phase 3 trials, we will have that predicate pathway now that we can apply to other clinical populations if we could show benefit. So yes, that is the intention. And then of course, other games as well that act on different neural
Right.
systems and have benefits in different populations.
Right.
Yep.
So that's this is something I was very intrigued by, and I'm sure that a lot of people in the audience, because it's still games for change, right? It's still about video games and making video games. There's something I think very interesting that stayed probably true from the beginning, that you found that mechanics, like game mechanics, right? Which is I mean, you probably can explain it much better, but to my understanding, this combines two core mechanics. One is navigation, right? That started with the old racing game, and one is completely different, which is in the old race game was identifying those signs, right? So how did it? One is how did it go to the newest creation? How did it translate? But also, why this mechanic, and is it the only mechanic, or you could find those pairs or those combinations in other places?
Yeah, so there's a lot there. Yeah, I'll try to break that down, and I'll do it from the game perspective, given the audience. And it's something that I often don't talk so much about it. People want to know more about the research and clinical pathway and the business side of it, but the game side is incredibly exciting and relevant and core to us as a company, and core to me as a designer and developer myself. First I'd say is that there are many different types of mechanics that can be applied using video games to lead to different benefits. And Neuroscape, that's what we do. We have over a half a dozen different games. Some are rhythm, some are meditation based, use different platforms, not just tablets, virtual reality. We have an augmented reality game that we're working on, all of which can lead to different impact on different cognitive systems and different populations. This particular game, my first, was designed with the hypothesis that if you could challenge a person's brain to focus on more than one goal, to rapidly move between them, to resist distraction, all of these processes, which we call cognitive control, are very demanding. This game, this particular way that we weave together challenge and reward, puts maximal pressure on those systems. And the hypothesis was that it would lead to benefit, not just in the game, but in cognitive control in different contexts, such as holding your attention to one focus in a very boring situation, which is our main outcome measure. And it shows, and we've shown even neurally why that is, that transfer happens. And so that is sort of the active ingredient of this particular game. Now, and it's also the basis of which is a method, which is the patent, intellectual property behind it. Now, that can be delivered in many different formats. As a matter of fact, it doesn't really have to be a video game. It does have reward, and it is a digital, so it's going to always be video game-ish, but you can back it off and make it more like an app, or you could bring it on, which is what we wound up doing. So what happened as we went from NeuroRacer to Endeavor over the last 6 years, having like an amazing team of video game professionals at Achille, is really preserve the core mechanics, the engine that's part of the patent that was the same as NeuroRacer, and then increase the level of art, music, story, usability, reward across multiple time scales, all of those factors, as well as the data collection and analytics, and even how challenges were delivered and adapted, all of those went up multiple levels across the full spectrum. And so that was the really exciting part of, besides the FDA story and the business side of what's been going on all these years, is that we worked really closely as teams of scientists and clinicians and psychologists with game professionals across the full spectrum to build something that's really unique, not just as a treatment, but as a game as well.
Right. And then there is the whole idea of how do you use it, or how the doctor prescribes it, right? I remember from the very first clinical trial that you've done, the Nature cover story, that what surprised you guys was how long the impact lasted, even though the gameplay was a month. I mean, over a period of a month. I think it was 3 times a week, if I don't
It was
correctly.
correct. Yeah, good memory.
And maybe an hour a day, something like that.
You're right. Yep.
And then now that you're 7 years later and you know much more, what's the ideal way to use it and for how long? Like how it's going to be given to people?
Another great question. So a little unpublished, but will be published soon, is that we even see some retained benefits like 6 years later from the participants in the Nature study. That's not published yet, but we've collected that data. So there's an incredible amount of sustainability of benefits and during, after treatment. And it's unclear exactly why. Like some could be just that the plasticity that took place during the game engagement led to changes that just endured. Another possibility is that the participant changed how they interact with the world around them. Right. Such that they've preserved the changes, not through the original ones, but that they interact with the world differently. These are all interesting and things that we're exploring, understanding now. So we know that the changes last. We have unpublished data from children with ADHD showing the benefits a month later, and that a retreatment of another month leads to increased improvements.
I see.
And that occurs whether or not the child's taking the stimulant. So it's not like the stimulant, this is unpublished, but coming soon. It's not that the taking a stimulant has maxed out the benefit and there's no additional benefit, because the study that was done that led to the FDA approval that's published in Lancet Digital Health, none of those children were taking stimulants at the time. We're taking, pharmaceutical treatment. So, but now we have additional benefits showing that it doesn't matter whether you are or not. It almost looks the same.
Right.
So we're slowly starting to understand more of the details about how this is optimally delivered, but we still don't know many things. So we don't know what the optimal dose is. And nor do we know like the minimal viable dose. What just gets enough benefit that can be turned off. We also don't know when you need to have a booster dose, right? This is not unusual. This is essentially what happens with all drug approvals too. You do the placebo-controlled study, you sort of have your best pick of what you use based upon your earlier phases, which is what we had. And then once you have approval, you could start doing larger studies and post-market research and understanding what is the optimal delivery of this. And so that's where one of the many research questions we have now is, how do we optimize the dosage and when it's delivered? And it's going to be complicated in a good way. I think that the ultimate answer is not going to be, this is it. It's going to be individual. Yeah. And we can use data to determine when that person has an adequate dose in terms of what happened to them and when that individual needs another dose. And how I feel strongly is if someone has the benefit from a month and then doesn't need it anymore, they should not have the treatment anymore.
Is there really too much? Is there overdose?
It's unclear that there's overdose, but I would say that there could be overdose from the perspective that you only have so much time in your life, right? And there's a lot of good things to do in the world besides video games. Now, I love video games. I'm not telling people not to play video games, but being outside in nature, having human-human interaction, if a game does not involve physical challenges, as some do, that's also important. So I think it's critical for a treatment that's being positioned as a treatment, not just as an entertainment product, although we hope it is entertaining, that we should know what the minimal is and be able to say, this is what we're treating you with at this dosage, freeing up other opportunities for different video game treatments that you might have different benefits from, and all the other things that you should be doing in your life.
Right. Okay. That's cool. So look, we talked about the past and this achievement, and I wanted to look a bit into what's coming, right, into the future. I don't know how many times you get that question, but when I talk in presentations about neuroscience games, I'm asking myself, can it be used for negative purposes? So if Adam Gazzaley wanted today to devise some negative impact with a video game with the same type of approach, could it be done? Can I hypnotize someone, or can I?
So if I became like a James Bond villain, I believe that anything that can do good can do bad. It's just the way nature works. I mean, training for a marathon seems like a super healthy thing, but it could also destroy your knees, right?
Yeah.
Even the best of medications or foods can be abused and cause negative consequences. And it's the same thing with the video game treatment, especially one that is targeted and adaptive and closed loop like the ones that we create. Sure, I think that you can move a neural system in any way. Sometimes it happens unwittingly, but it could happen by design. And I think that it's really important and responsible to have conversations like that. I do believe it could be used in a negative way, and it's important for us to be aware of it. And if we could treat a video game as seriously enough to say it's a class 2 medical device, which this is, we should treat it as seriously enough to say it can be used in a negative way.
Right. Okay, cool. Hopefully we learn to prevent as well, right? As anything.
Always.
The other thing I wanted to especially with the way we're under the crisis and things look now, when you look into the future, first of all, are you optimistic, if it's something we may ask? And also, when you look at that body of work of yours and others, what's the next milestone? Let's say, what excites you as the next big, if FDA approval is one big significant milestone, what's the next one or the next two that you're looking forward to?
I love talking about the future. It's my favorite place to live. And there's so much that I'm looking forward to. A lot of it was just waiting to get over these really long hurdles. But now that we have, it opens up some really important opportunities. Some are very science fiction sounding and, more technologically driven. Which I'll tell you about some of those that I think about and started engaging. And others are just like the diligence that you do as you bring something to market to help people. So some of the most immediate things are better understanding real world impact. It's really challenging to do that, even for a drug, for anything, even education itself, when you're doing randomized trials with smaller numbers. As we start going to market and eventually hopefully have millions of people that we're helping, we're going to be able to start looking at the impact on school performance, on real world impact, how it has benefit across different domains, from attention over to decision making and empathy and compassion. And that's really exciting from someone that wants to have impact, is to understand that. It's something that we always knew was part of our next step. With that, is a different type of scale. It's the scale to large numbers of people and globally. Like, we have just thought so small in so many ways, right? Nationalism is super, prevalent right now. I think the opposite, right? The need, I've spent the last 10 years traveling around the world talking about this topic. And what that has done to me is make me aware that everyone's sort of the same when it comes to this. Everyone has children that are suffering, parents with dementia. This is a human issue, not a US one or California one. And I'm really excited to have solutions like this that are capable of scaling because of the accessibility and affordability of digital technologies to be global. That is really something I'm very excited about. I'm really excited about finally unleashing the power of, mixed reality, virtual and augmented tools that have maybe struggled to really have widespread adoption. I think that there's an incredible opportunity, given the immersiveness and other assets that they have, to really become medicine and education tools as well. I would say that's another one, is reaching beyond clinical. Like, this doesn't have to just be a solution for people that have a clinical diagnosis.
Right.
Who doesn't want better attention?
Right.
And then all the other types of clinical and cognitive challenges. So I love the idea of thinking about this as for anyone that's looking for some degree of improvement. And, I think that another area that has been under research that I'm super excited about is the intersection between digital technologies like these and molecules, right? We've tended to just put everything in a silo.
Separate them, yeah.
I think that the ability to bring on a molecule in a lower dose, minimize the side effect, and look at the synergistic effects between an experiential treatment and a molecular treatment is incredibly exciting and underexplored. So there's a couple of things.
Right. We just scratched the surface. Adam.
Just the surface.
Yeah, I wanted to really, really thank you.
Thanks. This was a really fun interview. Thank you.
Thank you so much, Adam.